Hi, good morning. I'm Janisha,
And I'm Kaylee.
and we are going to be talking about the uninsured in the US. To start off with, I'm going to put a statistic in. Over 25 million people are uninsured in the US. Fortunately, Texas has the highest rate. I'm going to picture a scenario for you. You're 26 years old, you're not able to be insured through school due to classwork, and removed from your parents' insurance, and you cannot afford insurance. What do you do? Typically, by the time they finally seek care, the manageable condition has become worse than when it originally was going to be. Now they're in an emergency room facing large bills, tens of thousands of dollars, and it's bad for the patient and it's bad for the hospitals. What is health insurance? So, health insurance is a contract between an individual and insurance company that helps pay for medical expenses such as doctor visits, hospital stays, prescription medications, preventive care, and emergency situations. Popular types of health insurance are employer sponsored insurance, Medicare, which is for older people, Medicaid, which is for low income individuals, marketplace plans, which are under the ACA, and military and veteran health coverage programs. Also, there is the uninsured and the underinsured. The uninsured is a person who has no health insurance coverage at all. Underinsured is a person who has health insurance, but they still face significant barriers to pay for their deductibles and costs and copays because of the high expense. So, who are the uninsured? The uninsured are persons that are low income, working adults without employer coverage, young adults, immigrants, rural populations, minority communities, and basically the most vulnerable populations. Why do these coverage gaps happen? They happen because of the expensive premiums that range between $700 to $900 per month. Also, employment status is very prevalent to it because part-time workers, they don't receive any benefits, which means that they can't sign up for insurance. Also, Medicaid eligibility have strict income limits for each state, which makes it completely difficult to sign up for insurance. So, why does this matter? There are so many parts of this problem. We're going to look at the patients, providers, hospitals, and policymakers. But really, when insurance patients can't cover their bills in hospitals, especially at safety net hospitals, they have to absorb and eat those costs. Also, that makes hospitals go bankrupt, and also hospitals are being bought out by for profit systems. For example, the video that we had watched in class really showed a great description of this happening. On the other hand, private hospitals are required to treat emergency patients under a law, but they are not legally mandated to provide care in non emergency situations. So it's basically putting a band aid on top of the situation, and it creates a ripple effect in the healthcare economy. These are some of the statistics from 2020 to 2024. For the first time since 2019, the number of people without health coverage and the uninsured rate increased in 2024. The total number of people ages 0 to 64 without health coverage increased by more than 1.3 million to 26.7 million in 2024. The uninsured rate for the population under age 65 increased from 9.5% to 9.8%. There's a chart that shows basically how in 2024 that the health insurance, the uninsured population increased. Also, low income adults and minorities have remained consistently more likely to go without coverage, as we had talked about. Resources for the uninsured. Typically, they have limited access to provide primary care providers, preventative services, prescription medication, specialty care, and mental health services. And those consequences are delayed diagnosis, increased chronic disease complications, poor health outcomes. Uninsured patients typically have to search for community health centers or charitable clinics that do not charge them. And even then, the wait list can be ridiculous. In the Austin area, there are only 32 income-based free clinics, with 27 being on a sliding scale, which means they have to pay, and 4 being no cost. Also, the AMA does have resources vowing to help the uninsured as much as possible. Now we're talking about payment issues for the uninsured. A regular visit at the ER ranges from $1,500 to over $30,000, depending on the complexity of care. A typical American cannot cover that, and which allocates to medical debt and people having to decide to either pay their bills or pay for health care or not even going to go to the doctor to pay for any health care. And then it becomes a limited cycle of poverty and health concerns.
So, because of the budget constraints that hospital faces, it often affects the healthcare providers. So, the healthcare providers face ethical obligations like do they take care of the patient and send them out even though they're kind of just putting a band-aid on it, or do they, like, obviously they want to go further and actually help heal whatever is going on. um, there's a lot of resource strain because of the budget constraints. There's a lot of staffing cuts, which just hurts the nurse to patient ratio, leads to a lot of burnout, and it's oftentimes just like not even safe for the patient or the nurse. And for nurses specifically, this means that they have to overcome extra hurdles. So when they're discharging patients, most of the time they can't afford follow-up care or their medications. And then continuing treatment is difficult when there's no insurance to cover it. We've already kind of talked about how hospitals take a hit from uninsured patients. I specifically want to focus on rural hospitals though, because they do tend to have a more poor patient population. And so with that comes even more debt and lack of resources. And so these hospitals just ultimately end up closing. And then it's like, okay, if you can't afford to stay open, like we're just gonna not provide care to anyone in the area, which is even worse. So this puts a little bit of financial pressure on the government as well. But expanding insurance coverage actually saves a lot of money for everyone involved. So states that expanded Medicaid under ACA saw reduced emergency costs and improved preventative care uptake. And so when people have access to this routine care, they're a lot less likely to end up in really expensive situations at the emergency room and paying a lot more and using a lot more resources. Okay, so I think obviously the person who takes the biggest hit from this is the patients themselves, because when they're uninsured, they face a lot of the delayed treatment that we were talking about, and then the condition just becomes a lot worse. Not only that, but like when they are in this situation, they are carrying a lot of stress and anxiety about not only their physical health, but their finances as well. And then they can end up accumulating the medical debt, and that can stick with you for a really long time. So, some arguments to how our system currently is, some people say that healthcare is a fundamental human right and that more access leads to better outcomes, that prevents serious hospitalizations, um, if people have routine care. So, in the long term, the cost savings outweigh the upfront investment to giving these people access to basic care. And that was kind of relayed earlier when we talked about the comparison of states that expanded their Medicaid. Obviously, that means there is going to be this money coming from somewhere. Like if these uninsured patients can't afford insurance, then like who's paying for it? And that's kind of where the other side comes from. The expanded programs require a lot more government spending and higher taxes for everyone. And that's kind of just where capitalism comes in, and people don't want to share resources. Yeah, so there's no definitive right or wrong to these argument sides. I mean, it just comes down to whether the group as a whole believes that healthcare is a right or if they believe it's a privilege, and who should be paying for everyone's cost of care, and what responsibility the individual or the group has. So let's talk about possible solutions. The first one is just making insurance more accessible to these patients that are currently uninsured through Medicaid, marketplace subsidies, and employment sponsored coverage improvements. The second solution is just offering more free and efficient care upfront. So, like we talked about, the free clinics, mobile health units, and community health programs, just free access so those people have some sort of resource to somewhat access that, like primary or uh, pre preventative proactive care. The biggest solution that we can take on here is systematic changes, which obviously is going to take a lot of time and a lot of push and a lot of work and a lot of change. Um, telehealth access has become a lot more frequent since COVID, and we kind of talked about that. But on a larger scale, universal healthcare has been really, really good for other countries. And we're kind of like the exact opposite of that. And so the question is universal healthcare even feasible? And right now, the way our system is, no, just because we are a capitalistic society. And like we talked about in class, like money is at the root of everything. It's not really about patients getting care, it's about getting a profitable patient. And if that is the goal for our healthcare system, like we're not going to change from what we're doing now. And if you don't know, universal healthcare is just where everyone has healthcare, no matter if you're insured or uninsured or how much money you have, everyone has equal access to care. And this is successful in other countries because it is heavily government regulated, I guess. So everyone is paying more in taxes so that everyone can have healthcare access. The government is pouring a lot more money into their hospitals and into rural areas and into their healthcare providers and stuff. So it's really just about money distribution at the end of the day. And that's all for our presentation. Thank you.
Thank you.